At Basingstoke, we're quite an innovative lab. We were one of the first laboratories in the NHS outside of Public Health England to develop their own real-time PCR assay for COVID-19. And more recently, we have enlisted the help of a team of volunteers, many of them skilled molecular biologists. Amongst this team, we have a number of scientists, two in particular, Dr. Veronica Fowler and Dr. Bronnie Armson, who have experience in a technique known as loop-mediated isothermal amplification, or LAMP, which is a technique used for the direct detection of RNA or DNA of pathogens within clinical samples. So these two laboratory volunteers have worked with our clinical scientist in the laboratory, Stephen Kidd, to validate a new LAMP assay for the SARS-2 coronavirus that causes COVID-19. And this is the new rapid test that we are excited about and we believe shows significant promise for improving the detection or the time to detection of patients with COVID-19.
So what's your role been in bringing this test to Gibraltar and more widely as part of the GHA's response to the COVID-19 pandemic?
So in my role as consultant microbiologist for the Gibraltar Health Authority, I've been working with colleagues in Gibraltar and colleagues also in Public Health England to look at how we can bring testing for SARS-2 coronavirus in-house into the lab in Gibraltar. And that has required a degree of investment in new equipment and also a degree of training on novel techniques, techniques that are different to those already in place in the laboratory in Gibraltar for detection of other pathogens.
How reliable has this test proven to be?
So in our validation testing in our laboratory in Basingstoke, we've found that the new LAMP assay works just as well as real-time PCR from extracted RNA samples. Its performance when run directly on patient samples without the prior manipulation step shows a slight reduction in sensitivity, but no real change in specificity, which means that if you get a positive direct from a patient sample within 20 minutes, you can believe that positive. If you get a negative, then that sample would then need retesting through a different methodology after extraction of RNA in the laboratory to confirm those that are truly negative from those that have a lower level of virus present. Either way, we are very confident in the performance of the LAMP assay and the fact that it is considerably quicker than real-time PCR. So even a two-step approach to testing would still have some efficiencies in terms of time to result.
So is this aimed at supplementing the testing already in place or replacing the current system?
So this LAMP test will supplement existing real-time PCR methods. I think one thing that I've picked up in the time that COVID has been with us, certainly in our testing in the UK, is that reagents, as you will have heard in the media, are in very short supply and they will run out. So the ability to have different methods and diversity in methods for detection of SARS-2 coronavirus is really important for diagnostic labs, and our ability to be able to switch from one method to another as and when reagents become unavailable is critical in order to maintain a sustained testing and diagnostic capability.
When will Gibraltar be ready to start running these in terms of equipment and training?
We've been working very closely with a company called Optogene in the UK to obtain both reagents and equipment for performing the new LAMP assay. The equipment has already been delivered, and the reagents, which are being synthesized as we speak, will be delivered shortly. That will allow us, once we complete all the necessary validation of the assay, to look towards implementation of testing on site in Gibraltar in the very near future.